This presentation in our health intervention plan is for a form of tuberculosis known as extensively drug-resistant tuberculosis. So when referring to drug-resistant tuberculosis, there are two different forms or severities of this. The first one being multi-drug resistant tuberculosis, which means that the disease has become resistant to first-line injectable drugs or antibiotics. And then the one we're focusing on is extensively drug-resistant tuberculosis, which is even more resistant than multi-drug resistant tuberculosis, in which it has resistance to at least one of the three second-line injectable drugs as well. Although extensively drug-resistant tuberculosis is much more difficult to treat, the signs and symptoms of this disease are the exact same as regular tuberculosis, which includes violent coughing, coughing up blood or sputum, chest pain, fatigue, weight loss, fever, or night sweating. So any patient experiencing these symptoms should go to the hospital and be checked for possible tuberculosis or even extensively drug-resistant tuberculosis. The sad thing about this disease is that it's completely preventable. It's a man-made disease. It is made by patients not completing their full regimen of medications with regular tuberculosis. If they don't complete the full regimen, the disease then gains resistances to those antibiotics. So the main way to prevent drug-resistant forms of tuberculosis is to find ways to get patients to take their full regimen of medications. Treatment of drug-resistant tuberculosis can be very complex and costly. So as we mentioned, it is often much easier to prevent tuberculosis rather than to treat it. Through isolation or preventative measures, wearing masks often help a lot, especially in areas where tuberculosis is common. And when somebody is diagnosed with drug-resistant tuberculosis, they should seek expert consultation, or the doctors treating the patients should seek consultation as well with those who are experts in the field. Patients are often, treated with the standard regimen of antibiotics. Ideally, the regimen should be guided by drug susceptibilities, but as we mentioned, the drug susceptibility test can be pretty expensive. So usually the patients are just subjected to one antibiotic drug after another until the right one is found in order to treat the disease.
In a small region of South Africa known as Tugela-Ferry, specifically the KwaZulu-Natal province, there is a high rate of tuberculosis. In fact, at least 15% of these patients do not complete their course of treatment, and the majority of these individuals were either never treated or had not received the second-line drugs they were resistant to. Nosocomial transmission is thought to be the primary transmission of XDR TB. This area of South Africa, like many others, is deprived of advanced resources such as isolation facilities, proper ventilation, and respiratory masks. Can you imagine how quickly such a disease would be spread? Our group specifically chose the KwaZulu-Natal province because of their high rates of HIV. In fact, all of those that were diagnosed with XDR TB also tested positive for HIV, and 70% of these unfortunate patients died within 30 days. Patients co-infected with HIV also experience a higher risk of exogenous tuberculosis reinfection and relapse after tuberculosis therapy. 39% of antenatal clinic patients test positive for HIV in the KwaZulu-Natal province. Since XDR-TB was first discovered, over 50 health facilities have noted more than 600 cases. It is also thought that nosocomial infections are expanding into communities. Although quarantine techniques have proved to be effective, it can be extremely difficult to completely isolate individuals from their own communities. The majority of XDR-TB patients undergo the grand portion of their infectious periods within their communities. Drug susceptibility testing takes at least a month before results are returned. When patients have to stay in quarantine, they are then super-infected with XDR TB while waiting for results. Not only do these tests take time, they are also expensive. The majority of these TB patients in South Africa live in poverty and do not have transportation resources, therefore making access to these facilities even more difficult. Another concern is that drug susceptibility testing is only administered to patients that have persistent symptoms after a standardized first-line TB treatment regimen. So, the United States Agency for International Development, or the USAID, is a funded 5-year project executed by university research during the years 2009 and 2014. It works with the National Department of Health to support the growth and quality of tuberculosis services. It also assists with expansion of directly observed treatments in order to combat and control the spread of tuberculosis. The University Research Company, or URC, works with the local health departments to increase the availability of tuberculosis and HIV, and MDR-TB services. Advocacy, Communication, and Social Mobilization, or ACSM, uses mass media in order to increase awareness of tuberculosis symptoms, HIV symptoms, early testing, treatment, prevention, and control. Since 2009, the project has provided 85 grants to 67 non-governmental organizations, or NGOs, in all 9 provinces in South Africa. Non-governmental organizations and communities consist of door-to-door tuberculosis and HIV screenings. They also trace TB patients that are lost to follow-ups. They create support in communities by using DOTs. They encourage early testing and treatment, strengthen services for those patients that are co-infected with TB and HIV. So, one of the programs that we found in our research was known as Footballers for Life. And this program actually used retired professional football players to act as wellness coaches. And over in South Africa, football is what we know to be soccer over here in America. And these wellness coaches actually helped encourage appropriate changes in behavior in order to prevent tuberculosis and HIV. And because football is such a popular sport in South Africa, the program was actually extremely successful. Another interesting thing about this program is that it was focused on prisoners and former prisoners, because these individuals have a much higher risk of developing tuberculosis due to the overcrowding, poor ventilation, and limited health services that prisons have. In 2013, Footballers for Life received funding through the USAID tuberculosis program, and it reached almost 5,000 inmates and a little over 2,000 Department of Correctional Services officials. It also trained 1,561 inmate peer educators, and these individuals were also known as assistant coaches. And then lastly, it established 10 inmate-led DOT groups. I'm actually a little embarrassed to say that I don't even know how to pronounce the name of this organization. I tried Googling it and I didn't have any luck, but I do know that it means good life. So I thought that was interesting. But it also focuses on this district that I do not know how to pronounce. But this district is the poorest, most rural area in the KwaZulu-Natal province, and it also has the highest HIV rates. Some interesting facts are that adolescents in school systems have approximately a 50% chance of contracting HIV and eventually dying within their life. And then 15% of females contract HIV by the time they graduate high school, and 25% of those females eventually become pregnant. So as the previous slide stated, this organization focuses on tuberculosis in school systems, and so it cooperates with South African Departments of Health, Education, and Social Development, and in 2013 it received a grant through the USAID and expanded its school health program to an additional 10 secondary schools and 10 higher primary schools. They also established these mobile health units, and 8 of them are placed at school sites for 1 to 2 weeks at a time. And then they also have 8 counselors in these units. 7 of them perform health screenings, and 1 of them conducts the tuberculosis and health education sessions. The Philangelo organization, I'm not sure that's how you pronounce it, but this organization is a non-governmental organization in Tugela Ferry, and it was the first to recognize an emerging MDR TB epidemic. And this area of South Africa has the 5th highest MDR TB rates across the globe. And in 2007, several partners and the DOH, or the Department of Health, established one of the first community-based MDR TB management programs. And in this program, they completed treatments, they reduced overcrowding in hospitals, and they also created nurse mobile teams. There were 634 health workers that received extensive training, and more than 2,000 MDR TB patients received follow-up counsel. And in the KwaZulu-Natal province, they recorded some of the highest number of clients and trained injection team members.
How can we help spread awareness of XDR tuberculosis? Well, through the implementation of using social media and brochures. Social media. We can use Facebook in particular. We will post consistently about information regarding XDR tuberculosis, including defining XDR tuberculosis, how it is contracted, and how to prevent being infected. We can also post stories about those who have been diagnosed with XDR tuberculosis. These stories will help spread awareness of XDR tuberculosis, as well as spreading awareness of how people are affected by this disease. Another form of implementation would be through brochures. We want to create a brochure full of information about XDR tuberculosis that includes what it is, how to avoid getting infected, how to properly use antibiotic medications. We want to mainly focus on antibiotic medications, since that is the key component in contracting the disease. Social media will be effective in our efforts to implement our programs because it is the key form of communication throughout the world. For example, people can post about a certain topic and it can go viral within minutes by people who share or like a post. Social media is where people go to find the updated current events. Social media as well can be used to help form a solid support group effort in helping solve and prevent more cases of people being diagnosed with XDR tuberculosis. Here's a sample picture of what our Facebook page looks like that we had created to help spread the awareness of the threat that XDR tuberculosis plays in South Africa. Our Facebook page title is The Threat of Extensively Drug-Resistant XDR Tuberculosis in South Africa. On this Facebook page, we posted and shared information on the latest research that is occurring to help fight against XDR tuberculosis, as well as general information about XDR tuberculosis. If you would like to be taken to our Facebook page, you can click on the picture on the slide. Why make a brochure? Well, information pamphlets are a useful tool to get your main message across with tons of information regarding a specific topic. We plan that brochures will be handed out to every patient when prescribed antibiotics. This will allow for an opportunity to educate a wider population about XDR tuberculosis. Lastly, brochures are a quick and always readily available form of information to be accessed. Our brochure provides an easy and quick process to inform individuals about extensive drug-resistant tuberculosis. In the brochure, we address the topics such as the definition of XDR tuberculosis, how it is spread or contracted, and how an individual knows if they are at risk for XDR tuberculosis. The last topic we addressed in the brochure is notifying if there are any vaccinations for XDR tuberculosis. We plan on updating the brochure every year, especially on the topics of if there are any vaccinations for XDR tuberculosis. We plan on educating professionals who have access to these brochures to give a brief overview about XDR tuberculosis to their patients. The languages that our brochure will be translated into to accommodate the population are the top 5 South African languages. The languages that our brochure will be translated into are Zulu, Afrikaans, English, Setswana, and Sesotho.
To ensure that the brochures and other prevention information are distributed effectively, we'll be providing training to all healthcare providers to help them to know how to introduce and explain all the information given on the brochure, as well as suggest several effective ways of avoiding tuberculosis, or specifically drug-resistant tuberculosis contraction. Since the mortality rate for drug-resistant tuberculosis is much higher for patients who have contracted HIV, all facilities that treat HIV will be specifically targeted for thorough training on how to help those patients to avoid contracting tuberculosis. Multiple studies have shown that the most effective way to treat and prevent tuberculosis is through directly observed treatment. This means that the healthcare provider or worker is directly involved with the treatment or therapy for tuberculosis. Due to human error, sometimes patients do not take all of their medications as prescribed, and this is what leads to drug-resistant forms of tuberculosis. So to remedy this, all drug-resistant tuberculosis cases will require directly observed treatment at healthcare facilities. This sounds difficult, but most of the treatments for these forms of tuberculosis usually require injections anyway, which are difficult to do to self-administer. All regular tuberculosis patients will receive daily reminders from healthcare workers or designated individuals to ensure that they are properly taking their treatments every day. And they can receive these reminders through phone calls, emails, text, or personal visits.